1 second. Effect. Okay, so piezo is for foot. Electric effect is due to the difference in information that is going to be received from this part of the bone in comparison to the other part of the bone. So that has to do really with the activity of walking and putting and bearing weight on your leg bones. So piezoelectric effect has to do with the foot. Okay, so use the foot, walk around, run around. You're going to transfer the weight to the bones. You're going to do bone remodeling. Okay. So here is going into more details of what is really happening with the remodeling. Okay. So as we mentioned here, the weight of your body is going to come through the joint. So here you're going to have your hip through the joint, through the neck of your femur, and is going to be distributed in a way that the inner part is going to get the compression. And if this part is getting the compression, the other part is feeling the tension, which is kind of like an extension tension. Okay. And in the center of the bone, you have canceling of these two forces. So here is compressing, here is extending, and here is like nothing is happening. Right, so this is why you can really afford to have this hollow or this hole in the middle of the bone. Okay, so when you compress one side, you're really like stretching the other side. And this type of remodeling, it has a name, so it's called Wolff's Law. Okay, so the law says that the bones are going to be remodeled in response to how much you need them to get remodeled. Okay, and this is one of the issues that is quite a problem, or it was a problem until recent times, for astronauts. Because when you spend a lot of time up there, in space without real gravity, you're not quite putting pressure on your bones, so you tend to have a lot of bone loss. So you lose the density of the bones. But nowadays they have those exercise equipment that the astronauts have up there in the space station or something, and they artificially put pressure on their bones so that they keep their bone density. So you can imagine when you have these astronauts that stay up there, like, I don't know, 3 months, 6 months, by the time they get back to Earth and they step, without this gravity, they tend to break the bones, and especially like the thinnest part of the femur. You call that a hip fracture, but it's not really the hip breaking, it's really the femur breaking. So it's a problem if you do not use your bones very often, if you don't quite exercise a lot, you're going to have problem of fractures and loss of bone density. All right, so this remodeling is Wolff's Law. Okay. So here is a comparison of bone from a sedentary person, and you see you have a lot of thinning or losing density of the bone in comparison to another person who is always using the bones. You see a lot more mass, a lot more density with the bone usage. Okay, so this slide here starts to show what happens in case you do not have proper bone formation. So there are several things that you need to have healthy bones. Okay, so I put more stuff here. So you not only need good nutrition, you also need the presence of certain hormones. Okay. One vitamin that is very, very important for bone health is vitamin D. Okay. Now, vitamin D is very important for absorption of calcium through the diet. So the vitamin D works in your intestines to allow you to absorb calcium. And then once calcium gets into your system, gets into the bloodstream, then your bones will be able to absorb the calcium, and you'll be able to build bone tissue. So lack of vitamin D can, mainly in this case due to malnutrition, can cause what you call rickets. So rickets is really like softening and weakening of bones, and actually it's really not allowing the bones to form properly. Okay, so you don't have proper calcification of the bones. So when these children start walking and they start putting weight on those little legs, they're going to have deformities because of improper calcification of bone matrix. Okay, so rickets is mainly seen with nutrition that is not appropriated. Besides improper nutrition, there are some genetic conditions in which you do not have proper absorption of calcium to the intestine, and in those rare conditions you can also develop rickets, but mainly is because of lack of vitamin D in the food. Now it's interesting that in a lot of many parts of the world, you see that common items like milk, they usually get fortified with vitamin D, right? If you read the label on the milk, it says vitamin D fortified something. It is actually to avoid this kind of issues. So we say, instead, if you're not getting enough vitamin D in other ways, like for example, some sunlight exposure, right? You can get vitamin D through converting it from your skin. Actually, vitamin D comes from cholesterol, right? So you can have a vitamin D conversion like that. But let's say that you do not have enough vitamin D and you don't have enough supplementation, so you can get it through fortified foods or drinks. Yeah.
Purely the amount of vitamin D you get through sunlight.
Okay, question is how necessary is consuming vitamin D? Actually, I don't know the answer to that, because if you have a proper exposure to sunlight and you have all the other vitamins, you could synthesize your own vitamin D, but you might still need some that comes from the diet. So I don't know exactly the answer to that. You might have enough synthesis through your skin and liver and kidney, but you might supplement just to make sure you have enough. Okay, yeah, some people don't really have to take vitamin D, but it's always a good idea to have this minimal amount that is recommended. Okay, and also you got to be careful with vitamin D because it is a lipid soluble vitamin. Remember, naked, right? So the D part of the naked is vitamin D. If you get too much of it, it's also not good. Okay, so you have to have just recommended amounts, but not too much of it. Okay, because it goes into your nervous system.
If we have too much of it,
No, I'm not going to test you if you have too much of it. No, so but it's good to know that you should have just the right amount. You should not have too little. You should not have too much. Okay, that goes more into pathogenic stuff. So we're not covering that. Okay, just whatever I mentioned here, like rickets is a classic. Yeah. Okay. All right. So you need vitamins along with the calcium, right? So if you just take calcium, then you don't have enough vitamin D. You're not going to absorb the calcium. So what's going to happen to calcium? Is going to be getting out of your system. You're going to poop it out, okay? You eat the stuff, you don't absorb it, it goes out the other end. Right? It's simple. But more stuff happens to calcium, okay? All right, so what are the foods that are high in calcium? So foods that are rich in calcium, vegetables and nuts, right? So eat your vegetables, right? Broccoli is a very good one. Actually, broccoli is good for a lot of things. It's your DNA whisperer. Okay, bok choy, almonds, pumpkin seeds, okra. Who likes okra? One person. Yeah, I like okra. Like a ground beef, you put a little bit of vinegar so it doesn't get all the gooey stuff. We don't like gooey okra. All right. So look all this stuff here, and then you go to the supermarket and make sure you make your little list of healthy foods and get your proper nutrition. Even like Brussels sprouts. If you know how to prepare the food, it's very, very delicious, right? I mean, it depends on your taste too. All right, so eat your vegetables. Now, besides vitamin D, you have another vitamin here, that is vitamin C. Is this a lipid-soluble vitamin? No, there is no C on naked, right? So this is a water-soluble vitamin, okay? So if you do not take proper levels of vitamin C, you get scurvy. And that was a problem seen with Arctic people, right? And people who live in places that don't really have citrus fruits or other sources of vitamin C. And what happens here is that you have these signs of breakage of blood vessels. You bleed in several places in the skin, even from hair follicles, you get some bleeding, okay? Particular type of signs here. And if you look at the gums and the teeth of this person, you're gonna have gums that are bleeding. You have teeth that are receding. You see a lot of the root of the teeth, so a lot of periodontal disease. The teeth end up getting loose and they fall out. That's a kind of a nightmarish situation, right? Now, sometimes you have these nightmares that you're losing control of your teeth or your teeth are falling out. You know, that has to do with scurvy. Okay. All right. So in order to avoid scurvy, you have to eat your citrus fruits or the type of foods that do have vitamin C. Okay, onion is pretty good. Lemon, orange, you know, everything else. And this is a story because the scurvy was actually that disease that was seen very often with pirates in the old times when pirates or sailors would go to these long voyages. They wouldn't really have fresh fruits. And they would end up with scurvy. That's why when you see movies or cartoons depicting pirates, you usually see a pirate with like a patch, something happened with the skin or connective tissue, right? Because vitamin C is very important for collagen formation, right? And you see pirates that don't have, arms or legs. Well, basically because vitamin C is very important for healthy bones. Right, so bones get brittle, they break, so it's a big problem with vitamin C deficiency. So besides all that, vitamin C is also very important for the immune system function, right? So you know that whenever you're starting to catch a cold, you take some more vitamin C than you usually would take, and that helps to shorten the time that you actually feel sick with the cold, and it does help. Now, what happens if you take too much vitamin C? No, that's a good guess though. It's ascorbic acid, but no, it's just the name of the vitamin C. But it's not really that much acidic to change your blood pH. Yeah. Yes, this is water soluble. So one option is that you urinate it out. So it's very difficult to become intoxicated with vitamin C. Yeah. Yeah, diarrhea. That's a big one. So you don't just urinate it out, you kind of like, push it out in liquid form, very like explosive diarrhea kind of. You get the picture in your head. Yeah, do not try to take overdose of vitamin C because that will happen, okay? So yeah, it's not fun, yeah. But basically it's very difficult to get an overdose in vitamin C because it's water soluble. You pee it out, you poop it out, and you get diarrhea to really push it out. So I wouldn't be too concerned about overdose. But if you feel that you're catching a cold, take a bit more of a vitamin C. I think about 1,000 units, 1,500, that's acceptable, safe. Okay. All right, hormones that are needed for proper bone formation and growth. First thing that should come to your head is actually growth hormone. But here the first one that shows up is insulin growth factor, right? And then you have here, of course, growth hormone. Yeah, and he's talking about growth that has to do with growing the bones, right? The other name for growth hormone is somatotropin. Okay, somatotropin. Okay, Now, what is it that this growth hormone is going to do? It's going to stimulate the synthesis of protein, it's going to stimulate cell growth, and is going to stimulate the activity of those cells that start to build the bone tissue, right? Osteoblast, stimulate osteoblast activity. Your next hormone here on the line is thyroxine. Okay, you can imagine thyroxine that has to do with your thyroid gland. Where is your thyroid gland? Around here, around this area. Okay, it's a thyroid gland. Actually, you want to protect your thyroid gland even in routine dental appointments. You know, when you go to take X-rays at the dentist, hopefully the dentist will put this lead shield on you, and also some lead, neck protector or something. That neck piece is to protect your thyroid gland. You don't want to get too much, X-ray radiation on your thyroid glands, because that could lead you to developing some cancer cells. Okay, so you always want to be protecting your organs from the type of radiation, even from dentist X-rays. Okay, so thyroxine from the thyroid gland. Okay. Now, the thyroid gland is also going to produce other types of hormones, like calcitonin. We're going to talk about that next. And thyroid gland, in order for it to function properly, you need to have certain level of iodine. Okay, so without iodine, your thyroid glands are not going to work well. Okay, what is it thyroxine is going to do? Well, it's going to increase protein synthesis. So this is like thyroxine and growth hormone. Okay, increase protein synthesis, going to increase its growth rate, and look at this, it's very important for brain function. Okay, it will allow you to process things in the way you should process. And let me see here. Okay, increase enzymatic concentration that goes together with protein synthesis. Okay, now if you do not have proper thyroid functioning, meaning if your thyroid is under working, you get this thing that is called hypothyroidism. So low activity of your thyroid gland. So when you do not have proper hormonal levels from your thyroid gland, you can have very serious brain effects, and you're going to have delayed cognition, delayed processing. So basically, you have a lot of problem with brain activity, with a hypothyroidism, and that used to be called cretinism. Nowadays, I think they call they have different names for it, but the classical name was cretinism for the type of delayed or impaired mental capacity when you are deficient in thyroid hormones. So here, talking more about growth, right? When you have here your long bones, you're going to have the growth of the bone that is going to happen in two different ways. So one way here is going to be the interstitial growth that is going to happen at the cartilage, that is your metaphase, right? So here at the metaphase, you have this epiphyseal plate, okay? So metaphysis, so metaphase, I was thinking cell division. Metaphysis, so epiphyseal plate is right there. So when you look at X-ray of a bone and you see this clear area between your epiphysis and your diaphysis, you know that that bone is coming from a child, that X-ray is from a child, okay? So you do have interstitial growth that is happening here in this cartilaginous area. In what type of cartilage is that? I heard? Hyaline cartilage, yes. That's the hyaline cartilage here, and it's also all around this part that goes also to the joint. All right. Now, after you're done growing, your cartilage is going to calcify and is going to be substituted by bone tissue. I never like say once become is like it's going to be transformed. No, it's not transformed. Cartilage is going to degrade, is going to disappear, and then you're going to end up with bone tissue. Right? So when you look here at the bone of an adult, you're going to see that there is this area that is a bit different from the rest of this spongy bone. This area tends to be, it is more dense looking than the spongy bone. So this is what you call your epiphyseal line. Okay, so while you're growing, you call that epiphyseal plate. After you're done growing, it becomes a line. So it's epiphyseal line. The cartilage is not there anymore. Okay, now growth rate comparisons. Males tend to grow a bit more than females and also for longer. Okay, so here you have an average height of woman in meters, and in comparison to average height of men. Okay, and then look what happens here. The growth and maintenance of bone, as I mentioned, it not only depends on good nutrition, you also depend on hormones. Okay, so you look here at the line of the male growth, and you keep on growing until, well, before 30 years old. Here is actually pushing it, going like towards 30 years. I don't see anybody who is growing until they're 30 years old. Okay, I hope my kids will not grow until they're 30. You haven't seen my kids, right? Adam is 6'2", Alex is like 6'8". I already have to look up talking to them. One is 25, the other is 20. If they grow until they're 30, I have to change the doors of the house. You know, they have to like duck. I mean, your newer generation is growing always a bit taller than the older generations, right? But okay, so look what happens. The man will grow and then will stabilize for some time, and then you will hit your 60s and 70s. You have some like you lose some of the height. You kind of shrink a little bit. You're gonna see why, right? But then, yeah, hormones are changing, but kind of a steady growth. And look at this. These guys are very optimistic. They all live to 100. Yeah, I mean, all centennials here, okay? So, yeah, with males, they don't have to worry much. Look what happened to the females, to us, you know, privileged ladies, okay? So we grow, and then we hit, yeah, puberty around here and keep on growing until not 30, okay? 20 at the most, all right? And then you got kind of plateau, and then around 50, look at this drop. Between 50 and 60, what is happening over there? Menopause, perimenopause, menopause, and believe me, ladies, it's gonna happen. It's gonna happen. For you, like very far future from now, right? To me, I think I'm the only woman who can't wait for menopause. But anyway, so here, menopause happens, all right? And you have this huge drop. So you have change in hormones. You're changing the maintenance of the bone tissue. So at this time is when you start seeing a lot of osteopenia happening. So that's starting off losing bone mass. And then if you do not take care of it, it can go into osteoporosis. And that's when you really worry about breaking bones just because you're using your body. Okay, so you gotta be really careful about that. Well, I would say you should pay attention to this because mostly your moms or your grandmothers should be at this stage or passing that stage. You know, so make sure that they're taking the proper supplementations and they keep on exercising because exercise is gonna maintain your bone mass. And here is the chart of regular couch potato female that wouldn't really exercise. So that's why you see so much of this bone loss. Now, just in case. Okay. So after puberty, so until puberty, you have the growth hormone, thyroxine hormone. Then after puberty, you're going to have the other hormones that are going to be important for bone density and maintenance, right? So after you don't have those hormones anymore, as I mentioned, this is when you start hitting osteopenia and then osteoporosis, right? And also lack of exercise can also lead to osteopenia, right? All right, so here are examples of normal spongy bone tissue compared to a spongy bone that has osteoporosis. You see like the size of those spaces between the trabecula. Those are a lot larger than the other sides. There is a lot, you know, you see a lot more bone density. Okay. Now look at this. If you have osteoporosis, just by doing some normal activity, you can end up breaking a bone. That means walking. Imagine if the person go on a run and can break bones here and there and core pressure fractures. That must be really upsetting. All right. So here, where do you find a lot of issues with osteoporosis? You're going to find in the vertebral column, okay, that if you do have osteoporosis going on, the tissue is going to start losing the bone mass. And with age, as you lose the bone mass, you're not quite replacing it and remodeling it, the bone is going to start to compress. You're going to lose bone tissue, and this part that is sustaining a lot of weight from your body is going to start to compress, and not only the bones are going to be thinner, also the cartilage is going to be compressed. You see, in comparison to here, the discs between the cartilage, they do get compressed as well. And this is one of the reasons why people who are over 50 years old or 60, they usually complain of lower back problems, or herniated disc problems, or pinched nerve type of problems. And you don't even have to be that old to have this kind of problems. Sometimes you're in your 20s and you turn a certain way and you pinch a certain nerve, and then you put up another, and you feel like a shock in your back. Yeah, that's because this kind of problems. If you do some types of sports that really demand a lot on your back, and you're running on your knees and everything, so you can have this kind of issues. So you really have to know how to compensate and keep on practicing the sports that you really like. Okay, you can still practice the sports that you like until old age, but you have to compensate with other ways, like putting a lot of strength on your muscles, on your back muscles. So your back muscles can support a lot of your weight, and you don't really depend on your vertebral column to do all the work. Okay. All right, so this is what happens with old age. So here is showing, of course, a woman after menopause, and the compression of those bones at the vertebral column is not only shrinking in height, but is also exacerbating the curvature. So this is why also, older people tend to have this hunchback. It's not because they were in the computer all the time, all day long, not a good posture, but also because the bones are going through this process. By the way, it helps always to keep good posture. Right. All right, so here is a guy that doesn't look like an old man, but is already having issues with this hunchback situation. Why? Well, because you don't have to become old to start having this kind of problems. If you smoke, you're going to accelerate this kind of issues. Right? So smoke is not very good with maintaining bone mass. Okay? So you see here a chart comparing I don't see the non-smokers here. Oh, I had the graph showing the non-smokers, but basically the smokers will have a lot more bone loss when you compare with the non-smokers. Okay. All right, so things that are very important for bone maintenance and remodeling. So we know that the bones are going to store calcium, right? So you are going to control your calcium level in the blood by either picking up calcium from your bones, or if you have already too much calcium in your blood, you want to store some more calcium in your bones. So you always have to maintain a certain level of calcium, because calcium is important for a lot of physiological processes. It's important for proper neuronal functioning, muscular contraction, secondary messenger type of system, right? So calcium is important. It's very important for basically everything. So you always want to make sure that the levels of calcium in your blood are maintained at a constant, relatively constant level. So there are certain hormones that you absolutely have to know and understand how they work for maintenance of these calcium levels. So the first one that we're showing here is your parathyroid hormone. Okay, so your parathyroid gland, they have 4 of them, 4 parathyroid glands, and they're right behind your thyroid gland. Okay, so you have thyroid and the parathyroid right there behind the thyroid gland. Okay. Now the parathyroid hormone is going to relieve. It is going to your parathyroid gland is going to release the parathyroid hormone. Okay, it's called I'm just struggling today. Parathormone. So it's a parathyroid hormone. So that's the same thing. Okay. What is that hormone going to do? It is going to increase your calcium levels in the blood. Okay. So here you have. When is it going to work? When your blood concentration of calcium goes below normal range. So the gland is there, it has sensors, and the sensors are going to feel what is your calcium level in the blood. When the sensors of that parathyroid gland feel that your blood is low in calcium, then your parathyroid is going to start putting out the hormone. Okay. Now the hormone is going to get into the bloodstream, and it has 3 different targets. Okay, it's going to work in 3 different ways. First thing it's going to do is going to go to your bone. Do you have blood vessels in your bone? Yes, you have a lot of blood vessels in the bone, right? You don't have any cartilage, you do have it in the bone. Okay, it's going to go to your bone and is going to increase the activity of the cells that are going to break down the bone tissue. Those are called osteoclasts. That's the alien guy with a lot of nuclei, right? And weird tentacles. They are going to dissolve bone tissue, right? Increase activity of osteoclasts. So that is going to dissolve some of that stored calcium, and that is going to be dropped in the blood. So that is going to increase your level of calcium in the blood. That makes total sense, right? Another thing the parathyroid hormone is going to do, it is going to go to the kidneys. This kidney is kind of looking strange. It looks more like a bladder to me. But it's going to work on the kidneys. It should be like sideways. Okay, you have 2 kidneys, right? And it is going to minimize the amount of calcium that you are excreting in the urine. Okay, that means you're not going to pee out as much of the calcium. Okay, so you're going to reabsorb the calcium that got filtrated. So it's going to work in the bones, it's going to work in the kidneys. And another way that's going to work is also going to stimulate the kidneys to get the active vitamin D. So the production of vitamin D goes through 3 stages. First through the skin, then through the liver, and the last stage is on the kidneys. So the kidneys are going to convert your not active form of vitamin D into active form of vitamin D, which is calcitriol. Okay, so here, actually in the active form of vitamin D, you have calcium on the name. Okay, so now you are going to increase your vitamin D that is going to get in the blood again and go to your small intestines and allow you to absorb more calcium from your food. Okay, so now you're really acting in 3 different sites that are very important to bring up your calcium levels in the blood. Okay, so first one is in your bone, you want to take out some of the reserve. Second one, you don't want to urinate as much calcium. And the third one, you want to absorb more calcium from the intestine. Okay, so that's the job of your parathyroid hormone. Okay. All right. On the other hand, if you have too much calcium in your blood, when is it that you could possibly have a lot of calcium in your blood? Situation that you have a lot of calcium. Huh? You ate too much stuff that had calcium in it. Yeah, that's a perfect situation. If you eat a meal that is packed with a lot of calcium, you're going to have a higher level of calcium in the blood. Is that a normal thing to do? Yeah. You can eat, every time you eat, you're going to have calcium, you absorb the calcium, you're going to have high blood calcium. And then what do? Well, we have to take care of it, right? Now you're going to stimulate your thyroid gland, okay? So thyroid gland is going to secrete this hormone called calcitonin. It has calcium in the name. Now, the name of this hormone is telling you what it's doing. It's toning down the calcium from the blood. Okay, it's calcitonin, tone it down. Okay, calcitonin is going to work in 3 different ways in order to decrease your blood concentration of calcium. Okay, it's basically the reverse way when you compare to your parathyroid hormone. Okay, so what is it going to do? The first thing calcitonin is going to do is going to tell your kidneys that you have too much calcium in the blood, so you should urinate it out, more than you usually do. So you're going to pee it out. Okay. Second thing it's going to do is going to go to your bones and is going to tell your bone-breaking cells to stop working. Okay. So you're going to go to your osteoclasts and tell them to be quiet. On the other hand, you want to build some more bone tissue because you have to handle all this calcium that is in your bloodstream. So you're going to stimulate the action of your osteoblasts, right? So increase action of osteoblasts to build more bone matrix to use up the calcium, and you're going to quiet down your osteoclasts. So you're going to store more calcium in your blood. Okay. Another thing the calcitonin is going to do is going to go to your intestines, specifically here to your small intestine, and is going to tell your small intestine to stop absorbing so much calcium because you have plenty of it. Okay, so 3 ways that this thing is going to work. Right. So here is showing like the overall function is going to eventually lower the level of calcium in the blood. Okay. All right, so here is the exercise you have also in your homework. Now again, we do have homework that was due in chapters that we didn't reach yet. Forget about those. I'll postpone them until whenever we reach the chapter. Okay. Okay, so here. You want to keep usually your level of homeostasis, meaning proper calcium concentration in the blood, right, in the plasma. So what's going to happen here? If you eat, which you'll eat, right, you're going to increase your calcium level. Now what is going to come into play? Your thyroid gland, which is very, very important for proper metabolism, right? And that is going to produce calcitonin, that is going to tone it down, and you're going to reach your normal blood levels. Now, if your blood level of calcium goes down, you're going to activate your parathyroid hormone and secretion, and that is going to increase your calcium level. Everybody got this? Yeah, am I going to ask you something about this in the test? Oh yeah, this is when I say clue. I don't have to tell you, I'm telling you, I'm going to ask you. Okay. All right, so here is another little picture from your homework, right? Showing here in case you have a change in your homeostatic balance, right? So here, let's say your normal levels are 9 to 11 milligram per 100 milliliters or 10 deciliters, right? If your calcium level drops, your sensors at the parathyroid glands, they are going to pick up the sensors, they're going to send an information to have some type of reaction, right? Your target cells here are your osteoclasts. So osteoclasts are going to eat up or degrade some of that bone tissue to free up some of the calcium, and that is going to bring back your levels to normal levels. On last exam, I had a lot of people who did not understand what was happening with that little balance in change of a homeostatic balance, and a lot of people got that question wrong. So make sure you understand what's going on with the change, with the shift in the balance, and what is the the sensor, what is the response. Okay. Okay. So here, when you have uncontrollable low levels of calcium, you call that hypocalcemia. What are the consequences of long-term or a stretched period of time with low blood calcium? You're going to have your nervous system, especially your central nervous system, that is going to be an excitable level. Okay, because several things are going to change for the permeability of your neurons and cells in general. So hypocalcemia is going to get you into an excitable state in the nervous system. Now, on the other hand, if you have too much calcium, so hypercalcemia, so now we're going to see other things that are going to happen as well. So you're going to have problems also with the nervous system. You're going to have depression of your nervous system, okay? And you're going to have problems of reflex actions, okay? So your reflexes are not going to be as good. You're going to have problems with cardiac rhythm, because calcium has a lot to do with muscle contraction, and your heart is a muscle. If you have too much calcium in your blood, that is going to interfere with proper heartbeat, okay? And you're also going to have a problem with GI function. So the peristaltic movement in your GI is going to slow down, right? Remember, if you have too much calcium, you're going to tell your intestine to slow down this absorption. If you have way too much calcium for too long, you're going to really slow down, like not only for calcium absorption, but in general. And then you end up with pain and constipation, okay? So those are some consequences of not having proper calcium levels. Okay. All right, if you do not have a very pronounced hypercalcemia, if you have just a mild hypercalcemia, and that type of hypercalcemia that is also because of increased parathyroid gland activity, right? This can lead to formation of kidney stones. Okay, so hypercalcemia, so a lot of calcium is going to your kidneys. You can start to precipitate in some calcium, precipitates that can lead to stones. Am I blowing the time? Not yet. Okay. So kidney stones can be an issue. So this is mild hypercalcemia. If you have elevated level or serious levels of hyperparathyroidism, so this is not your thyroid, this is a parathyroid, okay? Then you're going to have, as a consequence, very weak bones and spontaneous fractures that can happen, okay? A similar case as we see with osteoporosis, okay? All right, so other hormones that come into action of controlling your bone density, you have here leptin. Okay. Leptin is released by your fat, so adipose tissue releases this hormone. Okay. Now, it may have some say into telling osteoblasts to stop working, so you're not going to be building up as much of your bone tissue, and this is a big problem. Okay, because the more fat tissue that you have, supposedly the more leptin you are producing. And if you're producing a lot of leptin, you're inhibiting your osteoblasts. That means your bones are going to be weaker. Now, look at the whole person. If you have a person who has a lot of fat, a person who is overweight or obese, with weak bones, that is a recipe for disaster. Okay? Because you're going to be very prone to bone fracture just because of regular activity. Okay, just walking can cause your bone fracture depending on the levels. Okay, so leptin is going to decrease bone formation. Serotonin, you're going to find, this is a neurotransmitter. Okay, but you're also going to find a lot of serotonin that is in your intestines. Okay, once you eat once you eat a meal, a lot of the serotonin is going to be secreted and is going to get into your bloodstream, and that is going to help absorption of calcium in your bones. Okay, so serotonin helps with building up the bone density. right, so bone repair, this is interesting part, right? Because you always need to be remodeling, and in case you have bone breakage, it's a very good idea to repair the bone, right? So some fractures will happen because of lack of bone density, like osteopenia, right, or osteoporosis, right? So you can have this type of compression fractures. I'm not going to test you on which type of fracture it is. So this is mainly FYI. So in case you have osteopenia or osteoporosis, you are really going to have a lot of bone thinning and some spontaneous fractures that will happen without anything major, like anything traumatic happening, right? So walking could break a bone, okay? On the other hand, if you have a person who is younger, right, did not undergo all those hormonal changes, or is not old age, right, you are going to see bone fractures, but mainly because of trauma or some accidents or sports induced type of trauma. Okay, you see that in case of like I don't know, football, baseball, running, you fall, you break a bone, right? Or any type of high level, high intensity activity. So there are differences in the ways that these bones will break and the ways that they get repaired. Okay. So here is a common type of sports fracture. You see that this thing was like twisted and then it broke, right? So this is called a spiral fracture. And let me see. Yeah, this is also a type of fracture that can happen with young kids or with kids that are growing. And this is called epiphyseal fracture, because remember, the epiphyseal plate is made up of cartilage, right? So if you have a trauma to a bone that is that has in the middle this cartilage, most likely the cartilage is going to have is going to break before the bone breaks. So this is really showing this type of epiphyseal plate fracture. Yeah. I'm sorry, can I hear you? Epiphyseal, you find it in growing people. Yeah, so girls or boys, if they have an epiphyseal plate that they are going through growth, you can find these types of fractures because the cartilage is a lot softer than the bone. It's a lot easier to break. Okay. Yeah. Well, I don't really know the techniques that the orthopedists use, but usually they would tract it, they would put it in place at the space that is supposed to be, and that is painful. So they would tract the bone and put it in the right place, and then the cartilage is going to reconstitute through the process of bone, fixing, bone remodeling. Okay, but when the child is growing, you do have a lot of these cells that are active, so they can divide and deposit new cartilage and reconstitute the tissue. So it's a lot easier for the tissue to be reconstituted. If these interventions do not happen with enough time for this reconstitution, then you can have some permanent damage. You can have this epiphyseal plate that got squished, and then one leg is going to be shorter than the other. It can lead to a lot of problems. But this is really more on the clinical side. Okay. But yeah, you can have bone reconstitution or cartilage reconstitution and normal growth after fracture, this type of fracture. And of course, the kids will always heal faster than older people. Okay, so here what happens when you break a bone, right? So here is a very bad type of bone breakage, like it broke all across. It's not this like green stem type of partial breakage, right? So first thing that's going to happen, that bone is going to bleed a lot. But usually you do not see a lot of bleeding because you have those membranes that are covering the bone. You remember the name of the bone, the membrane? Osteo, right. So you have the tough one. This one has two layers, right? Tough one on the outside and the thinner one on the inside. It has those cells that are stem-like cells, right? So when you break the bone, this thing has a lot of blood vessels. It's gonna bleed. So first thing you're gonna get is the hematoma. You're gonna get swelling. Not only the blood vessels will break, but the nerves are gonna break. And is it painful? Yes, it is very painful. If you ever broke a bone, you'll know what I mean. It's very, very painful. All right, I broke 2 bones. All right, so here, I tell you it's painful. Okay. So first thing's gonna happen is the hematoma. Your piece that got broken, it gets swollen, it gets inflamed. Sometimes you can have rupture. This one is like very much aligned bone breakage. But if the breakage is bad enough that the bone comes out of place and perforates the periosteum, then you can have a lot of hematoma and you're going to actually see it, right? So in this case, it's like simple actually composed fracture. But all right, so what happens first? First, you have a lot of bleeding. Then you're going to start fixing up that breakage area. Okay, so you're going to have cells that are your stem-like cells. They're going to get in there, and they're going to differentiate into chondroblasts. That's the cell that's going to make cartilage. So that's your hyaline cartilage. So your chondroblasts are going to make the cartilage. So here you're going to have this cartilaginous callus formation, right? And besides the cartilage, you're going to have also fibers. They're going to be deposited in that area, okay? So you notice here you have this fibrocartilaginous callus formation. This is after the hematoma, after the blood was absorbed, okay? And at this site, at this point, the bone, this part is cartilage, so you got to be very careful not to break this cartilage again, okay? Because you want to keep the bone aligned and you want to give it time for the bone tissue to start being reformed. And this is why, what do you do when you break a bone? Huh? You rest, but besides resting, you put it in a cast. Right? You had it immobilized because it's very easy to break the bone again because there's only cartilage there, okay? And it's going to be also very painful again, okay? So you put in a cast, you mobilize it, and you rest it. First thing, you're going to have this cartilage that forms. Second thing that's going to happen, your cartilaginous tissue is going to start to atrophy, just like with regular bone formation we've seen before. Okay, let's have a few minutes. And you're going to start having your spongy bone formation, right? And you're going to start having calcification. You're going to substitute whatever was there for cartilage with the bone tissue. You're going to have your ossification, kind of ossification center here. Okay, so this is called bony callus formation. And you look, this callus formation goes all around, like past the level here of the boundaries of your bone. Okay, you have bone, this callus going everywhere here. Okay. Then after that, you're going to start doing the remodeling. So you're going to substitute that area that has spongy bone. You're going to start building here your compact bone, right, with your osteoids, right? And you're going to do the remodeling, and notice at the site that you had the breakage, you can have a bit of a bump that stays there for this remodeling process. So usually when you look at an x-ray in a bone that was broken before, you can see a bit of a telltale sign that the bone was reconstructed, right, was remodeled. And how long it takes? At least 6 weeks, and then it takes months for all this remodeling to finalize. Okay. So usually when you break a bone, you stay with the cast for at least 6 weeks. All right, so here's one slide showing you the whole process of this bone healing. Okay, so here we come to these videos that I put for links that they're very, very, very explanatory, and I find them very helpful. Okay. And okay, so here this is a repeat slide. Oh, I forgot to take those out. Okay, we already talked about that. Okay, so finally we come here to chapter 7. You're going to start talking about the skeleton. We're going to start with the exoskeleton and looking at first at the skull. And then we're going to look at the vertebral column. And last, we're going to look at the thoracic cage. After that, we're going to look at the limbs. So that's going to be your appendicular skeleton. Okay, upper limb, lower limb, and important parts that you should know. All right. So looking again here at your different shapes of bones, so you should definitely recognize what kind of bone each one of those is. Okay. And now we're going to put more fancy names to the bones. All right. So terms that you absolutely have to know. Sinus is a hole is an empty space in the bone. You have to specify. It's not just a hole. It's an empty space, hollow empty space in the bone. Usually sinuses are covered by this mucosal tissue, right? So you have sinus. First thing that comes to mind is like, oh, if I have a sinus infection, all this empty space gets filled up with fluid, and that doesn't feel comfortable. Okay, the mucosa gets inflamed if you have a type of infection. So sinus. Foramen, that is a hole, right? That's an opening on the bone. Process, so that's a projection, right? Crest is kind of a process, but is more accentuated than a process. And this guy here, suture, that is like stitches together. So suture is just a joint that doesn't have a movement. You're going to find that mainly in the skull. Okay? Some pelvic areas too. All right. So looking here at the axioskeleton, so that's the bluish part that you have here. Axioskeleton is going to protect your brain. Okay, it's going to protect the brain, the spinal cord, and vital organs. Okay, so here is the axial when you the axioskeleton. And then when you look at your appendicular skeleton, that is going to include the clavicles, patella, and your limbs, and also this the hip bones and the legs. So limbs are for the appendicular. Okay. So looking at the bones of the skull, so since we're close to Halloween, so I always keep that caricature over there. You know, it's like, hey, bonehead. You know, this guy, these two guys, kind of looks like South Florida type of driving. You know, hey, you're bonehead, and you're numbskull. You know, name calling, traffic can be very enervating. All right. So starting to look at this skull from a newborn. Okay, how would you know that this skull is from a newborn? Well, the bones were not fused at this stage. So when you look here, you're going to find a lot of cartilaginous tissues between the bones of the skull. And do you remember how the bones of the skull will form? Membranous, yes, intermembranous ossification, right? Don't ask me to do this in the test. Okay. Okay, we have 3 more minutes with this. All right, so what happens here? You have those bones that formed, and between the bones, you're gonna have these spaces of cartilage, and then they're actually kind of soft. Now, if you have a newborn around, don't go poking this baby's head just to feel that the thing is soft. Okay, you're gonna be poking this baby's brain. Okay, but yeah, you have one part here that's called the anterior fontanelle. You call those soft places fontanelles. Okay, and then you have the back, the occipital fontanelle right there. And what is the purpose for the soft tissue? Yeah. But why wasn't it connected before the baby was born? Yeah, so it can pass through the birth canal. It's, I totally get it. If you have been through it, you don't need anatomy class to know why those are very important, right? I have never been through it. I had 2 C-sections. Yeah, I mean, can you imagine the size of the head of this baby going through, I mean, watermelon through water bottle? It it sounds very uncomfortable. I heard kidney stones are more painful, but I didn't have those either, so, okay. Yeah.
C-section just as bad.
C-section is very bad for recovery, yes, yes. And C-section is bad in a way that you do not usually expose the baby to the microbiome that is supposed to go through. But nowadays you have techniques for that. Yeah, you expose the baby anyway to the microbiome because it's good for the baby. Okay, yeah, C-sections, believe me, especially emergency C-sections, you can walk like 6 months like this because it's so painful. It's horrible. Okay. But then what happens here? The baby has to go through the birth canal. Usually the babies come out head first. That's the natural way, right? And it's getting squished. And it's getting pushed. And if you don't have these fontanelles to kind of squeeze those bones into a bit of a smaller space, I believe that either the baby is going to get stuck or it's going to be even more painful, right? Then if you look at the head of the baby, as soon as the baby is born, how does it look? Like a cone head, deformed, right? You look at the newborns and you're like, oh my goodness, they look ugly. And in case of my younger brother, I mean, that was really hard. He was so ugly, I tell you. He's okay now. I mean, my mother's neighbor went to the maternity and she was like, oh, how is Henrietta doing? She's okay. He's like, how is the baby? And she's like, oh, poor Henrietta, what an ugly baby. I mean, the neighbors, her friends are saying that, okay? Sad. But yeah, the head of the baby looks like a cone, and these fontanelles accommodate for passage through the birth canal. After a few days, the head goes back into shape because this thing is malleable, right? Cartilage goes back into place. And then the baby starts to look cute, eventually, hopefully. Okay. So what do you find in the head? First thing that you're going to see here is your frontal bone. But look at the baby. When the baby is born, it kind of has 2 frontal bones. But you look at the adult, you only have 1 frontal bone. So this thing is going to fuse, okay? This is going to become a suture. You're going to have 1 frontal bone over there. Then the baby is born with 2 parietal bones, one side of the head, right? How many bones do you have as an adult? Still 2 parietal bones. Okay. All right, so cranial bones, bones in the cranium. You're going to have a set of bones that are going to encase your brain. And then when you look at the face, the front here of the head, you're going to have your facial bones, right? So you have a lot of cranial bones they're going to enclose the brain, and they're going to allow your head to be attached to your neck. Very important, okay? Then of facial bones, you're going to have the framework that is going to get here the mandible, and mainly the only bone that is going to move in your head is going to be this part. Okay, it's going to be your mandible, if I'm remembering correctly. Okay, so all the other bones get fused and they don't move. Okay. Okay, so let's see here what we need to know. All right, so starting here with the part that encloses your brain. So that's going to be your neurocranium. Okay, so that's basically bones of the skull that are holding your brain. You're going to have 4 pairs and 4 single bones. Okay, besides those, you're going to have the other part of the skull that you're going to call visceral cranium. So those are going to be your facial bones. Okay. With the facial bones, you're going to have 14 facial bones, and only one of them moves. Okay. For some people, that one moves a bit too much. All right. So here is the summary, putting all the bones, but of course we're going to look at them in more details and the features of each one of those bones. So just to start here, looking at the cranial bones, you're going to have the frontal bone. Okay, so here, cranial bone, you're going to have frontal bone, only one. You're going to have parietal bone, you're going to have 2 of them. Occipital bone at the back of the head, you're going to have only one. Okay? Temporal bones on the sides going to your ears, you're going to have two of them. Okay? Then you have these strange bones here. You have ethmoid bone and sphenoid bone. Those are strange looking bones, but you're going to have one of them, one of each. Okay? Then when you look at the facial bones, there are lots of bones here for the facial bones. Again, we're going to focus in some that are more important here. Besides those, you have a floating bone that you call the hyoid bone. So that one is not really connected to anything but your muscles. It's kind of a strange bones. So those are called accessory or associated bones. Besides that, you're going to have some tiny, tiny little bones inside of your inner ear, right? And those are also associated bones. They're very important for feeling sound vibration and transmitting the sound vibration to the cochlea, right? The part that is going to interpret the sound as electrical impulse. Did you ever stop to think how you can hear things? Sound vibration hit the tympanus and it gets converted to electrical impulse to your brain, right? Into your brain. That's really odd. And it's even a stranger thing when you start thinking about smells, because the molecule hits your sensors, goes straight to the brain, but the molecule never goes in. It's only electrical signal. That's kind of scary, right? Same thing goes with the taste. It's all electrical signal. Yeah. Wait until you get to the nervous system, right? Okay. So here, let's just cover here these cranial bones that I just mentioned. You have to know where they are, what they look like, what are their features, right? All these cranial bones here. Okay? And then you get to the sutures. So we're going to have three main sutures, and you're going to have to know which ones those are. Okay, what are the sutures? They're immovable joints. They are the bones that fuse together in a zigzag line to really make sure that this whole helmet is making mainly one piece to protect the brain. Okay, so sutures are very important after bone fusion. Besides that, you're going to have foramina. Those are the big holes, especially this big one over here. What is that hole important for? For the spinal cord, right? So that's like a magnum. It's a big one, the big foramina. All right, so I'm going to stop there, and we pick up on. Oh, gee, today's Wednesday already. We pick up on Monday. Is Monday the test? Okay, so until here, until your skull bones, I'm going to include in the test. Okay, everybody got that? All right, so make sure you know this is skull bones, not the facial bones. Okay, these main parts that I have mentioned about the 8 bones in the cranium, you should know that. Yeah, until this part. Yeah. Yeah. Until slide 38.
Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and two pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. Located between the orbits, the ethmoid bone makes